Welcome to Rheumatoid Arthritis presentation by Group 6. Sarah Helm, Anna Helton, Samantha Ryan, and Rachel Robertson. So the specific cause of rheumatoid arthritis is unknown. There are several theories surrounding genetic predispositions to immune responses, specific gene factors, environmental factors or lifestyle triggers. There's some theories on hormone involvement, specifically with menopause and pregnancy, which obviously only affects women. And stress is something that is posited to affect or trigger rheumatoid arthritis. Some of the characteristics are that it is a systemic autoimmune disease that can be present in any diarthrodial joint. It can also be associated with issues with your heart, lungs, skin, or eyes. Symptoms can involve swelling, loss of strength, limited range of motion, pain, and visible deformities of joints. Acute episodes include malaise, fatigue, and widespread pain. The most commonly affected joints are hands, wrists, knees, and feet, although sometimes the C-spine and SI joints are affected as well. Courses and anatomy involved. Antigen triggers activate B cells, T cells, macrophages, and antigen antibody complexes. From there, B cells continue building inflammation, which activates the complement system and recruits a ton of immune cells to go into the joint. And that excites an inflammatory response, which only increases the joint inflammation. A ton of immune cells enter the synovial membrane, so then those cells produce more cytokines and create factors for swelling and inflammation, and eventually goes into the surrounding tissue and causes damage to the cartilage, also causing bone erosion and cysts and fissures, and that inflammation causes shortening and ruptures around the tendons. The top left image shows the joint as it initiates inflammation or the inflammatory process. And as you move to the right and then down to the bottom, you can see the pathologic changes from rheumatoid arthritis. You can see inside the joints where the cartilage is being destroyed at the edges. And then finally at the bottom, you can see the erosion of the bone and the areas of joint deformity happening at either end. For the incidence rates and statistics, approximately 0.5% to 1.1% of the population is affected. Both men and women are affected, but women are 2 to 3 times more likely to develop rheumatoid arthritis. This gender difference does disappear in older ages, so that's generally after menopause or the average age of 50 for women. RA affects all races. It's not affected by geography or political borders, and familial history does put an individual at a higher risk for developing rheumatoid arthritis. So how is it diagnosed? The patients are required to have at least one swollen joint and the absence of alternative diagnoses. And there's a classification system that is used to rate the criteria and you have to meet a threshold of 6 out of 10 or more. The criteria involves looking at number and size of swollen joints, the presence of antibodies or lack thereof, and inflammation markers. Ideally, the earlier you can diagnose and treat rheumatoid arthritis, the less disease progression you'll see and the less damage. And some damage is reversible, so the prognosis is better long term. For late stage diagnosis, there are blood tests that check for antibodies and inflammation markers, which can give an indication of how progressed the disease is, depending on those levels. And radiography is also used to assess structural damage caused by RA, such as that bone erosion or ruptured tendons, that sort of thing. Treatment involves patient education, symptom management, structural damage prevention, and the preservation of function. So symptoms such as pain, swelling, and stiffness are treated with NSAIDs and corticosteroids. Synthetic disease-modifying anti-rheumatic drugs are typically introduced early because there's a lower chance of disease activity and higher remission rates. And biological agents are effective for controlling inflammation and preventing structural damage. And if there is disease progression, surgeries can be used to provide joint replacements, resulting in pain relief and deformity correction and functional improvement. The prognosis for rheumatoid arthritis. An early diagnosis of RA is important to initiate intervention because if it's diagnosed and treated early, progression can be halted and reversed. Progression of the disease varies between individuals. Some may have a sudden or gradual onset of symptoms. Individuals with RA can experience exacerbations and remissions, while the majority will develop chronic progressive RA. So one group does ebb and flow, and others are just kind of a steady pace. If left untreated, RA can lead to increased morbidity and mortality. And interestingly, prior to the development of newer medications, RA was found to cause a decrease in life expectancy by 10 years.